most commonly searched questions on Google. One of them is rhinoplasty.
Hi everyone, I am Dr. Sasikanth. I am a senior consultant cosmetic and plastic surgeons in Yashoda hospital. What is rhinoplasty? Rhinoplasty is a procedure where we reshape the nose. So we reshape the nose according to certain ideal characteristics of the nose, according to which we will reshape the nose as much as possible nearer to that ideal nose. So in which conditions or what are the situations where we reshape the nose? So most of the times it is because of cosmetic reasons, like the looks of the nose. A dorsal hump. Dorsal hump is the hump where on the dorsum of the nose, you will have a big hump. So we treat the dorsal hump, or sometimes bulbous tip of the nose where we have a big bulbous nose, or sometimes you have a flat nose or a collapsed nose, nasal bridge. So or sometimes you have a wide nasal base. So these are multiple abnormalities where rhinoplasty has to be done. The next question is, how long does rhinoplasty take? Generally, rhinoplasty takes approximately 2 to 3 hours based on the defect or based on the amount of correction that we have to do in the nose. So it varies from 2 hours to 4.5 hours also at certain times. And sometimes the surgery anesthesia time and before anesthesia time and after anesthesia time, they took around 2 to 6 hours or sometime. It's generally day or two admission is required, 1 day or 2 days of admission is required. Certain preoperative investigations and preoperative blood tests have to be done. The next question is, what is the recovery time after rhinoplasty? Generally, postoperatively, day or 2 days, where there will be some swelling around the face, and generally depending upon the changes that we make, your nose will be blocked for 1 or 2 days. So the nose will be packed to stop the bleeding or oozing of the blood that happens. After that, 24 to 48 hours, that pack will be removed and the nasal cavity or airways will be cleared. And the swelling will remain for around maybe a week or 10 days, especially around the nose, around the eyes. There will be some swelling. It will take 2 to 3 weeks for the swelling to become completely normal. And there will be some amount of gaps in the nose because there will be operating inside the nose everywhere. So that takes few days to clear completely. Next question is the rhinoplasty painful? It's not very significantly painful. Any surgery, some amount of pain will be there, but it's not painful surgery where patient will perceive the pain because surgery will be done under the anesthesia. Post-operatively, some amount of discomfort will be there immediately after the surgery, especially since both the nostrils are blocked and he has to breathe by mouth. So that is the only discomfort that patient perceives little bit more immediately after the surgery. Once the packs are removed, generally patients are very comfortable with very less pain or discomfort. The next question is, can rhinoplasty be done for medical reasons? There are certain conditions where some people might undergo some amount of accidental trauma to the nose and that nose becomes deformed. So in that situations, there will be some amount of breathing difficulties or obstruction of the nostrils on one side, and especially the breathing difficulty can be especially while exertion. So these are certain medical conditions. Also, there are certain congenital anomalies of the nose where some nostrils, one side nostril will become closed or decreased in size, which causes problems in breathing. Sometimes there will be dysfunctional internal nasal wall. So because of that, there will be sudden nasal obstruction when there is extreme exertion. So these are certain medical reasons where we do rhinoplasties, especially when there is abnormality of internal walls, we put spreader grafts inside, or if there is problems in the nostrils, we open it up and resurface with grafts. So these are the medical conditions where we do a rhinoplasty. The next question is, what are the risks and complications of rhinoplasty? See, any surgical procedure, be it rhinoplasty or any other surgical, carries some basic amount of risk. There will be some amount of pain, there will be some amount of swelling around the nose or around the eyes after the surgery. There will be some amount of difficulty, especially during first 2 days where nostrils are blocked to curtail bleeding or oozing of the blood. Sometimes there can be allergic reactions to the drugs, especially the anesthesia drugs and other antibiotics that can be used. Or sometimes there can be a need for second rhinoplasty or third rhinoplasty because the patient might not get satisfied with the result what he has got. So these are certain risks and complications associated with rhinoplasty. The next question is, how do I know I am a good candidate for rhinoplasty? Many a times, many people compare their noses, some celebrity noses or some other their personal icon noses, and they think that their nose should be like that. Can it be done? No. But we can modify their nose so that they can go as near as possible, their nose can look as near as possible to their the nose that they want based on their facial characteristics. We can't change the facial characteristics. So we have to reshape their nose according to their face so that it looks better on their face. So we cannot emulate other person's nasal characteristics onto this particular person. So has to be modified according to his particular face. So because nose has to be in balance with the rest of the face. We cannot have a small face with a big nose, and similarly a big face with a small nose. So the nose has always has to be in balance with the rest of the face. The other things is any other medical conditions where there is a deviated nose or anything, that is obvious. But the cosmetic reasons, the main indication for rhinoplasty is a perceived clear-cut defect where a person can identify, I have this problem of my nose which needs correction. If a person can be able to identify his problem, he is a perfect candidate for the nose rhinoplasty. The next question is rhinoplasty costly? Rhinoplasty is not very costly. It is affordable for everyone based on the type of the procedure that we do. Sometimes we have used implants. So in that situation, implant cost will add. Sometimes we need to do the procedure which is a little bit, it takes more time because of cosmetic adjustments that we have to make. Sometimes it takes time for understanding the defect of the nose, especially while doing surgery. And sometimes we have to redo things inside the surgery when the surgeon is not satisfied. So according to that, the cost of rhinoplasty is based mainly because of the length of the surgery and the fineness of the surgery. So, but it's definitely not very costly and it's not unaffordable. So I hope I have answered most of the questions regarding rhinoplasty. Thank you very much.